Hi, everybody. Thanks for coming. I'm Marty Antony. I'm a psychologist at Ryerson University in Toronto, and I'm also affiliated with the Anxiety Treatment and Research Centre in Hamilton, Ontario at St. Joseph's Healthcare, which is just outside of Toronto. This is an outline of what I plan to talk about today. So I'm going to begin with an overview of the DSM-5 anxiety disorders. Social anxiety disorder is one example of an anxiety disorder in the new edition of the Diagnostic and Statistical Manual of Mental Disorders that came out in May. We'll then go into a more detailed discussion of social anxiety disorder, an overview of what it is, how it's different from just regular shyness, for example. We'll talk about causes of shyness and social anxiety and fear more generally. We'll talk about assessment of social anxiety disorder. And then the rest of the day will be focused on treatment of shyness and social anxiety. So I'll begin with a discussion of medications, talk a little bit about complementary and alternative treatments. There's not a lot of research on them, but there's a little bit. And then I'll talk a little bit about research on cognitive behavioral therapy versus medications, and studies looking at the combination of cognitive behavioral therapy and medication. And the rest of the day we'll be speaking about sort of strategies, sort of how to use different strategies for, psychological strategies for managing social anxiety. In particularly cognitive strategies for changing anxious thinking, behavioral strategies like exposure, for example. We know one of the most powerful ways of reducing fear is by doing the thing that you're afraid of. We'll talk about social skills training, a little bit about mindfulness and acceptance-based treatments. And then if we have time, we'll also talk a little bit about strategies for enhancing motivation for treatment, a little bit about group treatment, and a little bit about self-help treatments. Now, I also just want to speak briefly about the role of biology in social anxiety. Compared to other anxiety problems like OCD, for example, there's, I'd say, less research on the role of biology in social anxiety, but there is a little bit out there. We know that social anxiety runs in families. There's a little bit of research on twins, where they look at the concordance rates in identical twins versus fraternal twins, so monozygotic versus dizygotic twins. And based on those studies, they can estimate how much of the sort of covariance in social anxiety is due to genetics versus environment. And a moderate amount seems to be related to heredity. So there does seem to be evidence supporting a role of heredity. In terms of identifying specific genes or anything like that, we're not quite at that stage with social anxiety or most anxiety problems. Even with other anxiety problems like OCD, where occasionally there'll be a study showing that they've identified a gene that contributes to OCD, those studies are very hard to replicate. You know, the studies where they find the gene always make it into the news. The failures to replicate never make it into the news, so you don't hear about those. But there's not a lot of consistent evidence in terms of identifying specific groups of genes. In terms of neurotransmitters, serotonin is one that seems to be involved across anxiety problems. We know that drugs like the selective serotonin reuptake inhibitors, the SSRIs, are effective treatments for a range of anxiety problems, including social anxiety disorder. In social anxiety, though, there's also some evidence that dopamine may play a role. And then lastly, in terms of brain imaging studies, so these are studies using functional magnetic resonance imaging, PET scans, less so recently, more fMRI more recently, and other newer imaging techniques. We often, in social anxiety, will see increased activity in the amygdala and the insula, and there's also some evidence of possible reduced serotonin 1A and dopamine D2 receptor binding in some regions of the brain. The amygdala, you may have come across the amygdala in other contexts. The amygdala is part of the limbic system that's involved in fear. So you would actually see increased activity in the amygdala in any anxiety-based problem when people were exposed to a frightening situation. And then in terms of hormones, there's some research on cortisol, for example, suggesting that it may play a role. So some studies have found elevated cortisol in people with social anxiety disorders. Other studies have found lower levels of cortisol, and including a study, Beaton and colleagues, is a study that I collaborated on. And it's the cortisol literature is a bit of a mess, and there's so many differences in terms of how studies are done. So there may be differences between children and adults.
the chronicity of the problem. So some studies suggest that early in the development of a problem, say in post-traumatic stress, when you first have the trauma, you see elevated levels of cortisol. And then over time, the body kind of adapts to that chronic arousal, and you see lowering levels of cortisol compared to people who have never had a trauma. So the chronicity of a problem may play a role. And then there's other factors that studies may not control for. So the timing of cortisol collection. So we see higher levels at certain times of the day than other times of the day. For example, the use of oral contraceptives may affect cortisol levels. So that literature is a bit of a mess, but that's an area that people have been looking at.